Good afternoon. Thanks for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Friday, November 27th, 2020. This is our third briefing this week, and I want to stress that we are doing this more frequently now because of the evolving nature of the virus. We want to keep all residents of Newfoundland and Labrador as up-to-date as possible. We've seen several more cases since our last briefing, and in a moment, Dr. Fitzgerald will give her team's latest update. But first, I want to say thank you to every resident of Newfoundland and Labrador for being so diligent during these trying times, especially over the last couple of weeks as more cases of COVID-19 began showing up here. To say it's been a long year would be an understatement, but now is definitely not the time to become more complacent. Please, continue to follow the public health guidelines. Wear your mask, wash your hands, and keep your distance. 3 simple ways to stop the spread of COVID-19 in your communities. The extra measures we brought in this week will also help us avoid what we are seeing across the country, with spikes in COVID cases and businesses unfortunately having to close. Digging a little deeper now will protect our local economy, but more importantly, your health. We are getting so close to having a vaccine. Last night, I joined my fellow premiers to speak with the Prime Minister. We talked about COVID fatigue, and we all agreed that continued cooperation will be critical, particularly to the rollout of a vaccine. To know that COVID vaccine would become available within a matter of weeks, perhaps even as early as 2020, is incredibly encouraging. Last night, the Prime Minister outlined Canada's readiness. Because distribution is so important, my office has been in contact with the members of the Canadian Armed Forces who have offered to help in the delivery and distribution of the vaccine to the people of our province. Work is well underway in Newfoundland and Labrador. And I'll have more to say on how the plan will roll out with our officials here at the Department of Health and the Armed Forces in the coming days. But I will say this, we know how important the role of our friends in the military played earlier this year during Snowmageddon. So we are only very happy to continue to welcome their efforts in assisting us in getting through the next phase of this pandemic. With that said, I'll now turn it over to Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 4 new cases of COVID-19 in the province. The first is a male in the eastern region between the ages of 60 and 69, and it's is linked to a previous case. Contact tracing is underway in that situation. We also have a male aged 50 to 59 in the Eastern Health Region and a female aged 50 to 59 in the Eastern Health Region, and a woman in the Western Health Region aged 40 to 49. Investigation into the source as well as contact tracing is underway for those 3 cases. And it's still very early in the investigation, so it doesn't mean that we don't know the source, it just means that we're starting the investigation. The total number of cases in our province is now 331. 296 people have recovered, and we have 31 active cases. In total, we have tested 61,320 people. We are beginning to see an unwelcome but not unexpected trend in the daily number of COVID cases reported in our province. The next 4 to 6 weeks will be a true test as we enter the holiday season. This has the potential for a perfect storm as the threat of COVID and Christmas collide. But we know so much more than we did 7 months ago. We have the tools to prevent COVID from taking hold in our province. So just as you layer up for the cold weather, remember your layers of protection to prevent against the spread of COVID-19 this December. Reduce your close contacts to a small, consistent group. Remember, 20 for 2020. Stay 6 feet apart from those outside your bubble. Avoid large gatherings and parties. Wash your hands often and well. Wear your mask in indoor public spaces. Stay home if you feel unwell, and call 811 if you have symptoms of COVID-19. Since we announced additional public health precautions for rotational workers and their families, we have received many questions, so I'd like to address some of these now. Please note that these answers do not apply to international rotational workers, or those coming from a work site with an outbreak. So can a partner of a rotational worker go to work before the rotational worker has the COVID test on day 7? The answer is yes, provided the rotational worker is not symptomatic. And what if the partner works at a long-term care home or personal care home? The answer is still yes, but the partner must ensure that they are wearing PPE when in contact with close clients. Question 3, should a partner of a rotational worker wear a mask while at work? And the answer is that it depends on the nature of the work. If you are sitting at your desk alone in a contained office with walls and a door, then you don't need to wear a mask. But if your work involves interacting with others, then you should always wear a mask. Should the partner of a rotational worker wear a mask while teaching at a school? The answer to this is yes. And should a partner of a rotational worker wear a mask in another house with friends or extended family? The answer is yes. This mask policy does not apply to children of rotational workers. They would only be required to wear a mask in the same situation as their peers, such as on the school bus or an indoor public space. They do not need to wear it in their classrooms or when in another household. The reason that we did not include children in this policy change is that we do not want them to be further stigmatized any more than they sometimes already are. And let me be very clear in saying stigmatization should not be happening. It is completely unacceptable, and to be honest, it is heartbreaking for me to hear. If you are a parent and witness any ill treatment, discrimination, or bullying of a child, regardless of whether they have a parent that is a rotational worker or simply because they had a runny nose, I implore you to act. Act by talking to your children, by showing empathy. Ask your child to imagine themselves in the classmate's position and how sad and worried they must be feeling. Teach them the golden rule, to treat others as you want to be treated. Act by example. Your children see when you are afraid, and little ears are everywhere. If you voice concerns about a neighbor or another parent who recently traveled, your child will pick up on that. Parenting is hard, and it is even harder in the time of COVID. It is a tremendous and even overwhelming responsibility to raise children to be compassionate and respectful adults. Children learn what they live, so please remember that the lesson your child learns in this pandemic will have a lasting impact on how they treat others throughout their lives. As a recap for those who may have just joined us, we have 4 new cases since yesterday's media advisory. The total number of cases in the province is 331. Please be kind. I know COVID is taking its toll on all of us in different ways, but we need to dig down and find compassion. COVID has taken much away from us, but when this is all over, let us not say that it has taken our humanity. Thank you.
Thank you, Dr. Fitzgerald. It's certainly no secret that we are facing challenging times in Newfoundland and Labrador. But let me assure you, once again, that your health and safety is our government's top priority. Late last night, I joined Mayor Dean Ball and the rest of the Deer Lake Town Council for a Zoom meeting. Anxieties have been high in the town as residents have grappled with COVID-19 and the clusters in the community that have even affected the schools. But thanks to measures taken out of an abundance of caution, the situation is getting under control. Parents and students can trust officials and trust that school is a safe place to be. Many of you are also wondering about Christmas, wondering what this year's celebrations and festivities will look like. Undoubtedly, it will be different, memorable and different. I was thinking about this the other day as I watched them put up the Christmas tree outside the Confederation building. I was thinking about the early part of this year, after Snowmageddon, recalling those great stories of neighborhood groups spontaneously banding together to shovel out an elderly neighbor, while others helped collect food for those who needed a hand. This, of course, was followed by the pandemic lockdown, where once again those random acts of kindness made people smile and warmed people's hearts. It's ironic how a virus that kept us apart in many ways brought people closer together, albeit virtually. It certainly has been a long year, and it's not quite over yet, but we will get there. Please try to remember that as you get ready for these upcoming different holidays. Support a local business. Help a friend or family member who may not be as fortunate as you are. Reach out to someone you haven't connected with in a while to ensure they're doing okay. And if you feel like you need help, please reach out. You're not alone. We just need to be a little more patient, a little stronger, and together we will get there. Today, I'm also thinking of those with COVID-19 and their families. Please know the province wishes you well and a speedy recovery. Stay safe, Newfoundland and Labrador. Take care of yourselves and each other, and together we will get through this. Thank you. I'll now turn things over to Minister Haggie for his remarks.
Thank you very much, Premier. Before we start today, I'd just like to give a shout out to our next generation of physicians. The medical school has its annual charity gala on Saturday night. This is going to be virtual. It's going to be COVID aware, and it is the theme of the Roaring 20s. So you'll be able to donate online. If you live in town, there's some virtual food you can share, and there are silent auctions as well. I was delighted to see the efforts that they've made, and I'm sure the charities that they support each year will benefit from this. Well, it's day 265 of our lockdown. Dr. Fitzgerald has given you the numbers, and we've seen again our active cases for the day rise to a total of 31. This is obviously something that we don't particularly want to see, but we had said before, and we'll probably end up saying it again, that we will see cases from time to time. The important thing is that these are identified, contained, and traced. And on the basis of performance to date, we have been able to fulfill each of those requirements. And we've done so principally because we've relied on the gold standard for COVID prevention, which is the quarantine period of an incubation period. Much as we would like to deal with this in some other way, there really isn't as yet a way around it. We have heard a lot about point of entry testing, and there was a technical briefing for the media immediately prior to this event, and we'll be sharing that information again with other elected officials later on today. The point of entry testing cannot and will not provide the peace of mind that everybody wants. The evidence does not support its use, and we have said all along that Dr. Fitzgerald's recommendations will be based on evidence, not decisions that are made arbitrarily or for ideological reasons. We've seen that happen in other areas, and the Premier, myself, and Dr. Fitzgerald are determined that that should not happen here, and we need to keep our eyes and ears firmly focused on peer-reviewed evidence where possible, but certainly evidence coming from trusted sources. Dr. Fitzgerald referenced a perfect storm of Christmas and COVID. There is another element I'd like to bring up, which is the influenza season. Normally in this province, we see our first peak in around late December, and we're one of the few places in the world that actually has a second peak later on in March. Our numbers are encouraging. We have, as of earlier this week, vaccinated just shy of 189,000 Newfoundlanders and Labradorians, 36% of our goal. That's set against 132,000 for this time last year. We have another 50,000 appointments booked. And should we be able to get through all of those, and there's no reason unless they don't attend, we will be not far off the 50% vaccination mark for our entire population. This is great, but our target is higher than that. It's 85%. So timeffortheshot.ca, and you can go and organize a flu shot for yourself, your loved ones, your family. Do it online at a time that suits you, will avoid congestion, and protect you against a virus for which we do have a vaccine. We have also facilities through each of the regional health authorities, and there are contact numbers there to arrange a flu shot at home for those individuals who are vulnerable and unable to travel with any great ease. The next phase of that is that the school vaccinations have rolled out for eligible children and students. They have not yet completed, and they will work through over the course of the next couple of weeks. So that's a very positive thing too. That is the one thing that we do have a vaccine for, which you can avoid. And I would encourage everyone to avoid the flu where it's all possible. Vaccine discussions have been top of mind at the health ministers' calls. We had one the other night, and we will be having one next week to discuss about the rollout. I was interested to see that the Prime Minister has appointed Major General Danny Fortin as a lead for logistics for nationwide distribution of the vaccine, particularly with the challenges around cold chain and that kind of thing. This gentleman has a stellar reputation as the commander of the Joint Operations Command, one of our premier commands within the Canadian Armed Forces. And as the Premier referenced, we will be integrating that with our provincial delivery through local commanders, such as was done during Operation Lentus. So in closing, Dr. Fitzgerald mentioned layers for winter. Well, we have layers of protection that we can all use. And Newfoundlanders and Labradorians have, on the basis of the numbers, if nothing else, shown themselves more than willing and more than able to follow that. So avoid crowds, avoid close contacts outside your bubble, and keep each other safe. Wear a mask for your colleagues, for your friends, and for your vulnerable loved ones. And so with that, Premier, I'll hand it back to yourself.
Well, thank you, Minister Haggie. We'll now take questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Premier, you spoke with the Prime Minister last night, as well as the other premiers, regarding vaccines. What will distribution look like for Newfoundland and Labrador?
Well, these are all elements that we began discussing last night. Again, it's early stages yet, but I was encouraged that the armed forces had been offered, and certainly that's help we're going to avail of, and we've already reached out to them and have had conversations about how to integrate them with the work that's already being done here in Newfoundland and Labrador with our vaccine committee. So the vaccine will be available hopefully in January. It will be limited, and it will continue to roll as the supply chain rolls and as the producers amp up their supply. But we had a great call about how we can all work together collectively as provincial leaders with the public health officers and their local jurisdictions to ensure that we're following the evidence to ensure that people who need the vaccine get it first and foremost, and then continue to roll out after that.
I guess just to clarify, those who need it first, who would that specifically be?
Well, we're hoping to collectively land on guidelines, but that said, there was a general consensus, as there has been among the federal bodies, and Dr. Fitzgerald can speak to this as well, around the types of people that would require the vaccine first. So the most vulnerable, so people in long-term care facilities, elderly people, people with comorbidities, Indigenous communities, and healthcare providers. And, it was stressed on the call from my perspective that it would be great if we had a Canadian guideline so that we could all follow, albeit with some modifications for local jurisdictions and differences of populations and geography. But certainly a Canadian guideline would be very helpful, and one that would be welcomed by Newfoundlanders and Labradorians. But the general premise and the general consensus was on those populations that I just described.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
The case that we saw yesterday in Deer Lake was a young person who, from what we're hearing from the community, had been at the intermediate school there. I've heard concerns from parents who are saying, why aren't kids who were in that person's class tested?
Dr. Fitzgerald?
So I'm not going to speak to any specifics of a case, but certainly if public health had the information that somebody was in school during their infectious period, then that whole class, as we have done previously, would be asked to quarantine. That's not been the case. So it's not just a matter of someone being in school, it's them being in school during the infectious period. So we have to remember that. So that doesn't mean that somebody who's been in school a week ago was infectious at that time.
So how do you know that for sure that someone wasn't infectious? I know you use 3 days as the usual standard. How do you know that they definitely weren't infectious 4 days before or 5 days before?
So the evidence that we have up to this point certainly points to people becoming infectious 2 days prior to symptom onset. And so that's the standard that we use, and we use across the country.
Okay, thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hello, good afternoon. We just had a technical briefing that I listened in on, and about point of extra testing, and I wanted to throw some very quick math. If we say we had 1,000 people arriving a day, 1%, quite possibly of COVID, that's 10 people, and of those, according to the Toronto study, 70% of them would test positive at the border, so that's 7. I'm just wondering, the other 993,000 people who end up with a negative test, 3 of those would be false negatives. Is that math correct? Like, it would be most people, the vast majority of people, would still be testing negative. Is that correct?
Trying to follow your math myself.
So
I
if
think
you
that's right.
tested 1,000 people, is that what you're saying?
Yes.
And you're assuming a 1% infection rate?
That's based on the
I'm trying to
McMaster
get around the
study.
70% number. It's 70% of people who actually have the disease. So if it's only 1% actually have it, it's the vast majority of those coming across are actually going to be testing negative. Is that not correct?
Yes, absolutely.
Okay. And so what effect would you say that 90-odd% of negative tests would have on the motivation of these people to follow strict quarantine measures?
Well, that is our big concern, right? If you get a negative test when you're coming into the province, then that may give you a sense of false reassurance that, I don't have COVID. And we all know that not everybody will test positive when they're first checked. It depends on when you were exposed. So if you were exposed very soon before coming into the province, you might be 5 or 6 days before you test positive. So there is that concern then that somebody who may turn positive later would not be quite as careful or would feel reassured that they didn't have to worry. And, you can to some degree understand people's thought process on that. If, I have a negative test, it tells me I'm not infected, but a test is only one point in time, which is what we've been saying from the beginning. It only gives us the result on this particular day at this particular time. So it's not really telling us what could happen in the future.
Okay, thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Is there a retesting for COVID patients after their 14-day isolations? And if we don't do that, why not?
You mean if they were tested positive, do we retest them after their isolation?
Yes.
No, so to consider somebody recovered, it's 10 days after symptom onset. If their symptoms are resolved, then we consider them recovered. The evidence that we've seen and that we've collected over the course of the pandemic certainly shows us that most people, their rates of viral carriage, their viral loads are such past, 8-10 days past the onset of symptoms that the viral load is so small that it's likely not infectious at that point. However, some people can carry remnants of the genetic material of the virus in their system for quite some time after they recover from the virus. And so doing tests in this group would give us positive results that really are not necessarily indicative of infectiousness. So, the utility of using our testing resources for that group of people it's just not borne out.
Thank you. And what does our current stockpile of COVID test kits look like, and what kind of flexibility do we have should there be a surge of cases and people getting testing?
Certainly we do have, I can't give you the exact numbers of testing supplies at this point. We do monitor that on a regular basis, and we get updated on that on a weekly basis. Certainly right now we have capacity if there is any kind of a surge to be able to do the testing.
Thank you.
Our next questions are from Roger Bill with The Independent. Please go ahead.
Dr. Fitzgerald, I don't think I've ever heard you talk about why you made the career change from being a family practice doctor to working in community health. But I'd like to ask you about the choice you made to take the job of Chief Medical Officer of Health. Did you ever think, as you made that choice, that you'd end up where you are now, in this position, facing a health crisis, unlike anything most of us have experienced in our lifetime?
No, but I don't think anyone in public health thought we would end up here. So, that's, it is what it is. We roll with the punches and take what comes at us, right? We always know, I guess, that these are possibilities, that these kinds of pandemics can happen, but I don't know if anybody was expecting that it would happen. So, it's certainly been a healthy baptism into public health, that's for sure.
To follow up, when you have a quiet moment, and I don't imagine there are very many of them, but when you do have a quiet moment, do you ever say, "Why me, Lord?"
No. Nah, there's no point. You just deal with what you got to deal with. It's. I consider myself very fortunate to be here and working with such an incredible team, and really to be able to be a part of this really important time in health history, in our history. So no regrets.
She may not ask why me, Lord, but I do say in my quiet moments, thank God that Dr. Fitzgerald and her team are on the case.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I have questions about the 3 cases under investigation that were identified today. Are 2 of those linked to each other, the ones in the Eastern Health Region?
So to the best of my knowledge at this point in time, Kellyanne, no, they are not linked to each other.
Okay, thank you. I just wanted to clarify that there was actually 3 separate investigations.
Yes, 3
ongoing.
separate.
Okay, great. And then my second question is, how many ICU beds do we have available in the province if a second wave was to hit us tomorrow? Or I guess we're in the midst of one, but if large numbers ended up having to go to hospital tomorrow.
We have around ballpark 113% 53% occupancy on the figures I saw earlier on this week. I can certainly get you those in detail. We have a surfeit of ventilators over ICU beds. We have somewhere of the region of 146, again from memory, and I can get you those figures too. Our challenge, quite frankly, is once you get to 146 ventilated patients across the province, the challenge will be staffing the bed and the ventilator. But I'll get you those detailed numbers. I've given you ballpark. If I'm out by a couple, I apologize.
No worries. Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Question about people are worried that we might have to go to alert level 3. What would it take for that to happen?
So certainly, if we're looking at increasing measures, so our goal, as we've said many times, our goal is not at this point to have the province go back to alert level 3, or any other alert level for that matter. Our goal at this point is to have very targeted response to any outbreaks or any increase in cases and non-epilink cases. So those are discussions that we're having all the time, and it's difficult to give a definitive measure right off the top because it does take some evaluation of the whole situation. So it's whether it's the case, not just how many cases we have, but how many cases that we can't identify a source for. What's the situation in that vicinity that we're in? Do we have a lot of travel in and out of that town, or is the town fairly isolated? All of these things will will influence our decision as to whether or not we move to another level or not. So there are many things that we will be looking at, but certainly non-epi-linked cases, so cases that we can't find a source for, are a concern for us. They're kind of like our canary in the coal mine, right? It means that there could be more widespread community transmission, so we're always very much on the lookout for those.
And you mentioned having things be more targeted. Other provinces have come up with zone systems in order. Obviously, our healthcare zones are very large geographically, so may not make sense. So how do you have a system already set up that would allow you to invoke measures for a specific area? How would that work? Yeah,
so we have not wanted to be quite as, I guess, prescribed or defined as to where those borders and barriers or borders of regions would be. I think we need to take that on a case-by-case basis because, some areas you may need to have, depending on the traffic flows and, the movement of people in and out of certain areas, if they're hubs in an area, you may need to have a broader area of restrictions. But if you have a place that's more, a little more isolated, a little less traffic in and out, you may be able to keep those restrictions narrowed in that area, narrow in the sense of geographic area. So it is a bit variable, and our geography, fortunately or unfortunately, I'm not sure, doesn't lend itself to being quite as prescriptive as maybe some other provinces would.
I think we're fortunate in the geography, though, that
maybe
we can. The regions will define themselves as if they happen, and different than some of the maritime provinces, which you suggested, Peter, are easy to divide up into squares. The way that the province has been settled can be leveraged to our advantage should outbreaks occur.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Hi. I wanted to ask either the Minister or the Premier what you make of the criticisms that have been leveled lately against the federal government for not having capacity for domestic vaccine production. Do you think that there's any legitimacy to those arguments?
Well, I mean, criticizing in hindsight is 2020, of course, and the capacity, I think, was the question for domestic production. And of course, that has historical context, and I think that doesn't help us address the problem moving forward. There'll be plenty of time to reevaluate where we should have been, how we should have been after the pandemic is done. I think the top priority, though, is navigating our way through the complexities of distributing the vaccine for the most vulnerable and then to the rest of the population moving forward.
Okay, thank you. And I have a question for the Minister. Early in the spring, you were providing updates on surgical delays, wait lists, that sort of thing. Have you still considered providing those on a regular basis? Do you have any recent numbers?
We haven't provided them on a regular basis. I do get regular updates through the staff from the regional health authorities, mainly focused on what our current work rate is compared with the comparable period last year. And I think for the range at the moment, depending on how you break them down between procedures and surgeries and that kind of thing, we're running between 96% and 112% of the activity level this time last year. In terms of people behind on the backlog, one of the challenges is the wait list. The regional health authorities only ever had those wait lists for 2 weeks. They were provided in the bulk of circumstances by physicians in private offices on that kind of schedule. So we have asked through the NLMA, the Newfoundland and Labrador Medical Association, to have some granular detail as to what an individual specialist wait was in terms of patient and caseload, and I'm still waiting for those figures.
Thank you.
Our next questions are from Richard Duggan with VOCN. Please go ahead.
Thank you. We've heard of a parent who tested positive for COVID, and their child initially tested negative for the virus and then ended up testing positive after. So what would you say to those who would argue that a negative test results create a false sense of security?
Well, this is the whole crux of the problem with the virus in general. It's the combination of the asymptomatic spread with the false negative rate of the test and the false sense of security that therefore creates. This is why Dr. Fitzgerald and her team have created such robust protocols to allow for these types of scenarios to exist, and with the full knowledge based on evidence and science that the false negative rate is 30%, and that it will take different time for people to convert, and that they can be in an asymptomatic spread period at that particular moment in time. So, I mean, Dr. Fitzgerald, I don't know if you want to comment further, but the protocols that she's put in place have fully allowed for this scenario, and with the idea of keeping people safe while it occurs.
Yes, I'd like to add, actually, there is, I mean, with regard to case investigation, just to clarify, when we're notified about a case, so sometimes public health knows about a case prior to them having gotten tested because they presented with symptoms, and then people are already isolating when they get that test done. But as soon as we find out about, as soon as the teams in the regions find out about a case, they will immediately have contact with the case, advise them that they must self-isolate, that anyone who has been a close contact with them must quarantine at the same time, and they ideally would have to self-isolate away from anyone in their household as well. So then anyone who subsequently tests positive, provided it's more than 48 hours after the start of that quarantine, they've already been in quarantine. So the risk then to anyone else is really negated by the fact that they're in quarantine. If they test positive initially, so all of the contacts that are identified as close contacts by that individual case, those people, in addition to being contacted and advised to quarantine, they are also tested at the start. And then at any point during their quarantine, if they develop more symptoms, they are tested again to see if they turn positive. If they've been in quarantine, as I said, and it's more than 48 hours past the quarantine point, then there's no further contacts, and so we don't have to worry about that. If it was in that first 48 hours, then we would do contact tracing on them, just as we would for any other positive case. So the system that we have set up is certainly meant to pick up those cases.
Thank you. And we've been in pandemic mode now for it seems like years, but it's only been 8 months. What are we hearing in terms of the lasting effects from COVID-19 from people who were, say, positive back in March, April? And what sort of are we hearing of any lasting effects that people are now dealing with?
We haven't had a lot of feedback in that regard in this province, but certainly, we have heard about people who have long-standing symptoms. I'm not a specialist in that area, so can't really comment to the actual evidence and science that's out there in that regard. But we do know that there are people who can have lasting impacts from a serious infection, for sure. And we see that with lots of different types of infections. I've worked in long-term care a long time, and And I know that people who get influenza, for example, they're often affected to the point where they don't get back up to their same level of functioning that they did before they got sick. So those sorts of things can happen with any serious infection that people get, and COVID is no exception to that.
Thank you.
Our next questions are from Roger Bill with The Independent. Please go ahead.
Thank you. Dr. Fitzgerald, last August I did an interview with Dr. Furey on the occasion of his winning the Liberal leadership. We talked about the challenges that he would face as Premier. We talked about the fiscal challenges facing the province, and he described things that worried him and kept him up at night, to use his words. I'm curious, as we face this pandemic, what worries you most? What figuratively speaking keeps you up at night?
It's not figuratively speaking. I think it literally speaking keeps me up at night. I mean, certainly the situation elsewhere in the world right now is certainly worrisome, and that we're always watching that very closely. And another thing that worries me is just people's level of fatigue and frustration, and with COVID and with the measures that we've had to put in place and with the changes that have had to happen in their lives, I think all of that is worrisome. We've been very fortunate here that people have listened and put their trust in public health and have listened to what we had to say and followed the public health measures. But I can appreciate that people's patience are wearing thin. But we do need to hold the line, and we need to keep going with those measures that we know work really well. So keeping your contacts low, making sure that you keep your distance when you're out in public, and if you can't, you wear a mask and you wash your hands well. And with Christmas coming up, you really try to stick to those measures as hard as it may be.
I think we've all come to learn that dealing with this is like trying to hit a moving target. I'd like to ask you a specific question about rotational workers. The protocol for them returning has gone from 14 days of self-isolation to 7, now to 5. From 5 and now to 7. And I'm wondering, as we learn more about the risk posed by people returning to the province and working elsewhere in Canada, has your team taken account of the difference between the impact of Newfoundlanders and Labradorians who work in Western Canada versus those working in the marine industries in the Great Lakes? And I think I'm correct that no marine worker is tested positive upon returning. And I suspect it has to do with the fact they're essentially quarantined on board ships for 4 and 5 and 6 weeks while they are at work. So my question is, if marine workers pose less of a risk than workers returning from the oil fields in Alberta, is your team considering fine-tuning the protocols even further to take account of that?
Some marine workers actually, because of the things that you've just mentioned, that they're working in a closed system, some of them actually do have relaxation of the isolation because of that reason. We take each situation, I think, into consideration individually, because not every company is the same and is exactly the same in what they do, and not every ship and every crew is exactly the same. Sometimes there's people onboarding, sometimes people have shore leave, that sort of thing. So we have to look at each situation individually, and we make a decision based on that as it comes to us. So it is something that we've considered from the beginning.
Am I correct? Have there been any marine workers tested positive?
That was actually your second question, Roger. It's just one question and a follow-up.
Okay,
but you'll
sorry.
have an opportunity now as I go through the final round, okay?
Sure.
All right, I'll now go back through each reporter to see if there are any final questions. Kellyanne Robert, do you have any further questions?
I do. One for the Premier regarding the all-party committee around COVID-19. The first meeting was held this week. From your perspective, how did that go?
It seemed to go well. It was, of course, chaired by Dr. Haggie, who can also weigh in here. It was an open discussion with the other two parties, and myself and Dr. Haggie. Dr. Haggie in particular gave a good update about where we were and where we were mainly listening to concerns the others shared, including the independent representative on the committee. from my seat at the table, it seemed to go well, and looking forward to continuing on next week.
And then, Dr. Fitzgerald, you alluded to, or you have alluded to in the past, of the tsunami that's just off our shores. We've seen the cases rising across the country. In our own province here now, Minister Haggie also noting a perfect storm. We could be near perfect, and we're still going to see cases. We know that's the reality, but how close to perfect do we need to be this holiday season to avoid massive cases coming through our hospitals?
I would say we have to be pretty close to perfect. You know, we all need to behave as if COVID is among us. There's just no other way around it, really. As I said before, we need to be thinking about things now like we thought about it back in April. We need to make sure that we're keeping our contacts low, that we're physically distancing as much as possible. We're wearing a mask when we're out in public and can't physically distance, and when we're in indoor public spaces. We're washing our hands well. We're staying home when we're sick, even if you have mild symptoms. If you have any symptoms of COVID, contact 811 or do the online assessment, see if you need testing. This is all really important stuff.
Thank you.
Our next questions are from Peter Cowan with CBC. Do you have any further questions, Peter?
I do have a couple. Premier, I'm wondering if you could weigh in on the decision to cancel public exams today. What's behind that?
Well, I would think that Minister Osborne and the school district kind of weighed what we're seeing across the country and trying to ensure that students have equal opportunity with respect to their grades. And I know this was one that the NLTA and parents that I heard from expressed concerns about earlier in the year, and we said we'd reevaluate it, and certainly Minister Osborne has reevaluated it.
And a follow-up question on the vaccines. We've seen the federal government says they expect to have enough to vaccinate 3 million people by the end of March. What do we know about how many of those vaccines will make it to Newfoundland and Labrador?
Well, certainly the discussion on the telephone last night was one based on per capita. There was not a full agreement on that, but there's certainly towards a consensus. So I would think that would be the modeling that we would be moving towards, a per capita formula for access and distribution of the vaccine.
So if I have that right, then that would be, we'd be expecting something in the neighborhood of 40,000 or so people to be able to be vaccinated.
Anywhere from 42 to 51,000.
Okay, thanks.
Peter Jackson with the Telegram. Do you have any further questions?
I have another math question, and this will be on the test.
It's late on a Friday, Peter.
I'm going to take notes here. Do I have to carry the one?
If the peak incubation period is 5 days, and that's the most common incubation, and yet this Toronto study is showing 70% of positive cases are caught at point of entry, what does that tell you about when incoming travelers usually are infected? It's obviously before they just get on the plane, right?
Yeah, so yeah, most people, if you are able to pick up that many, but the other thing you got to think about too is where people are coming from, right? So that number is dependent on the prevalence of where your cases are coming from. And so that all the evidence from that study is not in yet. I think, there's still some discussion yet to happen. So, we'll certainly be looking at that, but we'd like to see all of the information first. We do have a few questions about some of the results there. So, so a lot of people are getting, they're getting exposed in their day-to-day where they're coming from. So it may not be through the travel for sure, although travel is another place where you can get exposed. There's no doubt about that. So, which is part of the reason why we're recommending only essential travel.
Thank you.
Our next questions are from Richard Duggan with BOCM. Richard, do you have any further questions?
Yes, in the spring, in our first wave, we got to see some projections released from Dr. Rahman. Now that we're in our second wave and seeing those cases rise once again, can we expect to see some more of those projections released?
So I think Dr. Rahman's projections at that time were, they were an example. They weren't necessarily predictive based on the information that we had. Part of the reason for that was because of just the number of cases that we had. We didn't have a lot of cases, comparatively speaking, to other areas that were doing that kind of modeling. And so if we did modeling with the cases that we have right now, we may have some of the same issues with that. So I think we have to be careful about what modeling is able to tell us, and we use it. We certainly use the modeling group or not use them, but we use the information that they give us in a variety of ways. But I'm not sure our case counts at the moment, and I'm very happy about that. Would be able to really give us that predictive power.
Thank you.
Roger, Bill with the Independent. Do you have any final questions?
Yeah, I do. My apologies to my colleagues for asking a third question there. As my kids used to say, my bad. Dr. Fitzgerald, the question I wanted to ask you was, of the rotational workers who have tested positive upon return, have any of them been people from the marine industries?
So not to my knowledge, but I will say that with a caveat that I may not have all of the information about every case that's coming into the province, right? Those case investigations are carried out at the regional level, and I may not have all the details.
Okay, thank you.
Thank you, everyone. Premier, do you have any final comments today?
Thank you all for joining us today. Please look after yourselves and each other, and together we will get through this as a strong Newfoundland and Labrador. And I just want to reiterate that there is some encouraging news about the vaccine. There is hope on the horizon, but we all need to work to get to that horizon. And the work that we can do individually, your collective service to the province, which doesn't go unrecognized, is evident in the numbers, is to continue to follow the public health guidelines, wash your hands, wear a mask, and keep safe social distance. Thank you very much.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.